Hello. So I am live today and with Dr. Prem Shah, physiotherapist, a creator, will be live with me in short time. Yes, hello, Hasnain Khan, P.S. Desai, Dhimant Bhai, Ronak. Yes.
यस सो हमारे साथ जुड़ेंगे यस हेलो वेलकम प्रेम सर
Hello, sir. Thank you so much.
यस सो यस सर थैंक यू कि आपने इतना टाइम दिया हमें यू आर अदरवाइज
Sir,
यू आर टू बिजी पर्सन
nah,
यस रौनक हेलो हेलो रौनक और रौनक हमारे साथ है द ग्रेट प्रेम शाह सर ओके he is a creator he has created a YouTube channel physio trends his page name is physio trends और बहुत ही एक्टिव है बहुत डेली कुछ ना कुछ करते रहते हैं बहुत फिजिकली बहुत ही स्ट्रांग है अगर मैं सोचता हूँ कि कभी मुझे चैलेंज दे देंगे तो मेरा क्या होगा
ऐसा कुछ
यस
नहीं होने वाला सर, पर अगर आपको चाहिए तो मैं देता हूँ चैलेंज।
हाँ ऑब्वियसली मैं ट्राई करूंगा यस सो शैल वी स्टार्ट नाउ
Yes, sir. Yes, sir.
प्रेम सर okay so now let me ask you something that physiotherapy see many of people is not knowing so much about either homeopathy or physiotherapy अगर मैं अपनी बात करूं तो when I was studying so at the in third year first time this physiotherapy was mentioned in the text that physiotherapy can be helpful in this condition. I know regarding physiotherapy course and there was lot of scopes. Right now there is lot of scope in physiotherapy. But आप थोड़ा हमारे स्टूडेंट्स को गाइड करिए कि व्हाट इज फिजियोथेरापी बेसिकली एंड व्हाट यू कैन अचीव आफ्टर दिस कोर्स and what you can do after pursuing this course. Yes.
Yes. Sir, thank you so much for asking this question. Basically, physiotherapy also is a very young field as well as very old field, we can say. Like, because we have two theories
Yeah.
behind this. People say that physiotherapy started since the Krishna Janma. Like in Mathura, Krishna had given manipulation to one lady, and because of that, she became
Yes.
physically. So that story is also there. And if we talk about today's generation, so World War II, physiotherapy was started by Canada for treating their soldiers to get their soldiers back on the field. They started with the physical exercises. So that is how the physiotherapy is born. And after that, yes, we know that there has been a lack of awareness about physiotherapy. Nobody knew about physiotherapy, and people started working as a physio. Initially, they were also introduced as a massage therapist because of lack of knowledge with people. But we continued our work. We showed that being in the field of sports, in the field of neuroscience, in the field of orthopedics, in the field of
Yes.
cardiorespiratory, like in COVID time,
Yes.
also in
True.
ICU, treating all the COVID patients. Physios were there to reduce the secretions and functions, everything. So likewise, the opportunities were created, and the physiotherapists had started working, and they showed that they can do things in this field also, this field also. And I think that to lift up the physiotherapy profession, there is a big hand of all the athletic population, because if like normal person also knows physiotherapy, they know it because of sports physiotherapy. Like they want to they want to compare things with the, like, okay, Sachin Tendulkar got tennis elbow, and then after that he was treated by physiotherapist, he told in interview also. So that is also kind of
Yes.
popularity gained after athletes started revealing about their fitness journey, like Virat, if you talk about all the Indian actors, actresses, they also have back pain, everything. They tell that, okay, we are treated by physios, we don't take medicines and all. So likewise, we got popularity, as well as some senior physiotherapists are there who are working very hard to spread awareness. So this is how the physiotherapy came up, and now I feel like, I also used to feel that when I started physiotherapy, I started around 2007. That time awareness was very low. Like I used to say in Gujarat, to sir, people were telling us massage wala only or kasrat wala. But then like even I used to feel bad, but then I didn't take it as a negative point, but I thought that I can make it positive by making people understand that we are not only massagists or we are not only doing exercise, but we can do much more to them. We gave them results. Okay, like for example, stroke patients are there, then neurological conditions, CP patients are there. So we treated them, we showed them that with exercise itself, exercise is a big science. With this scientific exercises, you are getting treated and you are getting so much benefited. And I think that is one of the reasons that I have started with the physio trends journey. My main purpose is to spread awareness about physiotherapy, to motivate all the young physios that please spread more awareness about this dynamic profession, that how many things you can do. And
Yeah.
I'm proud that I'm able to do that, and I want to continue doing that forever.
And you are doing tremendous work. I know once upon a time, maybe 1 year back, I have asked you कि सर थोड़ा क्या है कि थोड़ा पेट बाहर निकल गया है, अभी बहुत बाहर का खाना हो रहा है, so please थोड़ा सजेस्ट कीजिए. And you send me 1 or 2 videos of yours. So when I watched these videos, मैंने बोला कि सर ये पुराने videos है. तो आपने बोला yes sir, these are very old videos. So then I just checked your page manually. Why? Because I want to search them manually. So मैंने देखा कि यार बहुत काम किया इस बंदे ने, तो हम कहाँ थे अभी तक. Okay. So our first meeting was at AHMC. Yes, Ahmedabad Homeopathic Medical College, Ahmedabad campus. Yes, and we knew each other with the help of that punching machine. Okay, you are coming and punching, and
Yes, yes.
what happened that Prem sir is very handsome. So many female teachers used to call him hello Prem sir, hello Prem sir. So I used to watch him. Okay, yes, he is Dr. Prem Shah. And what happened? Me and Dr. Manan. Okay, we organized the seminar, and you then just told me that Manan is your friend, and that's how we became friends. And
Yes.
after that, I asked you something, and you just provided me so many things. Or after that, I have checked that you are doing tremendous work. Okay, so hats off to you. This physiotherapy. See, I am telling you my experience with physiotherapy when I was working in Selby hospitals. So there were a variety of patients there: cardiac, respiratory, then this neuro. I didn't knew regarding these three branches connection with physiotherapy. I just only knew that physiotherapy has connection only with this orthopedics. So what happened? Once upon a time, I saw a patient of paralysis. See, when you are a freshie, when you are younger, you are just in dilemma कि भाई paralysis ठीक होगा कि नहीं होगा. And then that neuro physician, he told me that consult a physiotherapist for this patient. मैंने सोचा यार what is this? And then physiotherapist came, and he was very almost a very young person, and I think he has joined that hospital 6 months back, but very confident. Okay, हमारे यहाँ सेल्बी में पूरी टीम थी फिजियोथेरापी की. And then he explained to me, then other neurophysician explained to me that physiotherapy has got tremendous role in this. Okay, then what happened कि 2-3 पेशेंट जो पहले जिनको हुआ था, उन्होंने भी ऐसा मुझे कहा कि नहीं सर, with the help of physiotherapy, our movements जो चली गई थी पैरालिसिस की वजह से, वो 80% 80 से 90% बैक आ गई. So after that time, I started appreciating physiotherapy.
Right. So you won't believe, like somebody has asked, like physiotherapy का use क्या है, sir? I will like to tell him that, buddy, starting from your birth till death, physiotherapy can be helpful in doing any movements you want to do in your life. Like
Yes, true.
in children also, we are treating them for making them walk properly, sit properly, doing all properly. Then in school age also, like making the sports athletic body, all the things in that we are helping as a physio. Younger age, when you are working, your posture correction, your back pain, neck pain, shoulder pain, all the kind of pains whatever you have. After that, because of some bad habits, if you have got smoking, drinking, then you start getting heart pain, lungs pain. Then for that also physiotherapy is there. Stroke patients, just now we are discussing. Again, in geriatric population, when your joints are stiff, you want to make it more flexible, you want to move
True.
faster. For that also physiotherapy is there. So basically, from birth till death, everywhere physiotherapy can be useful. That's why we like to say.
Yes.
And that
I would like to share. Yes, sir. Yes, yes. You continue.
no, sir. Please tell them that, sir.
Okay. So I started my college in 2006, and at that time, in 2007, Shah Rukh Khan came with six packs. Okay. So there was a trend for gymming, and I thought कि भाई मुझे भी जिम करना है, मुझे भी सिक्स पैक लाना है. Already I had four packs because I was so like lean, thin, and emaciated child. लेकिन I joined gym, and on the first day that person told me, "Oh भाई, तू क्यों आया इधर? Okay, तू पहले किसी से फिटनेस लेके आ. Okay, किसी फिजियोथेरापिस्ट से मिल, उनको बोल कि वो तुझे एक्सरसाइज करवाए. Then you come here." Okay, so after few months I joined it, but it was my experience कि उन्होंने कहा कि भाई एक फिजियोथेरापिस्ट चाहिए होगा कि जो तुम्हें एक्सरसाइज प्रॉपरली सिखाए. ऐसा नहीं कि you just go to the gym and you just doing this dumbbells and barbells and no, not like that. तुम पहले ये पुशअप्स करो, पुलअप्स करो, देन जो इंडियन है दंड करो, वो सब सीखो. और अगर तुम्हें नहीं आता है, you just go to physiotherapist. So I was like, यार ये फिजियोथेरापिस्ट मैं कहाँ ढूंढूंगा, उनका चार्जेस कितना होगा? That I cannot क्या है affordable. I cannot. This is not affordable to me. So physiotherapy from birth to end. Okay. कभी भी कहीं भी सबको ये एप्लीकेबल होता है. यस सर.
अगर मूवमेंट करनी है, अच्छे से करनी है, तो वी आर ऑलवेज देयर. एनी मूवमेंट.
यस. यस सर. यस. ट्रू.
So, sir, what advices, like you are a very experienced person now in homeopathy, so what advices you will like to give to younger homeopaths? Because like obviously just now we discussed that we are teachers now, we are like somewhere we are at a position for them. So if something you want to pass on to them, like okay, this things if you are doing, you will be a very successful person. So what will be your advice like that, sir?
See, Prem and me, we both are almost, we are 30 plus. Yes, Prem sir?
Yes, sir.
Okay, and we are doing this hard work since so many years, almost 10 years. Okay, so the first thing is,
Yes.
there is no shortcut for success. There is no shortcut. It's journey.
Very.
Okay, and we both are enjoying. Okay, मैं अपने होम्योपैथिक के व्यूअर को और फिजियोथेरापी दोनों व्यूअर्स को बताऊंगा कि we both are enjoying this journey. Okay, success is daily process now for us. Okay, so young physiotherapist और homeopathists, मैं इनको कहना चाहूंगा कि the key to success is hard work and consistency. That's it. Nothing else. You have to work hard. इसके अलावा कुछ मत करो. Don't go to motivational speaker. They won't do anything for you. Okay. they just speak 2 or 3 good lines, and you will feel like you will feel just goosebumps. But ऐसा नहीं होता है. You have to work hard, and you have to work harder. Second thing, you have to work smart also. Okay, being a homeopath, see, homeopathy in India, it's a bachelor course, but in many countries it is a master course. You can pursue homeopathy after pursuing your MBBS degree. Okay, so it is master course. So, and the history of homeopathy itself suggesting that homeopathy can be studied after studying normal medicine or bachelor level medicine. Okay, so you just understand the process, the subjects of homeopathy. These subjects are not meant for all the people. It is the vitalistic approach. Okay, now I am giving a simple example that if me and Prem sir both are having malaria, and there are 5-10 or persons who get the malarial infection. So what happens in allopathy? You will get that Lariago or artesunate injection and so many IV fluids, etc., etc. But in homeopathy, it is different. In homeopathy, the medicines are selected according to my temperament, my constitution.
Okay.
Okay, Prem sir's temperament, Prem sir's constitution. Okay, the other 8 or 10 persons, their temperament, their constitution. So you have to understand each and every case. You have to understand each and every individual to practice homeopathy, and it is not the easy task. Okay, it is not the easy task. किसी को भी समझना easy नहीं है इस दुनिया में. हम अपने दोस्तों को भी नहीं समझ सकते. कई बार ऐसा होता है. So therefore, to get succeed in your homeopathic career, you have to work hard. You have to follow books. You have to see patients. See, a teacher's day है, इसलिए being a doctor, मैं प्रेम सर के साथ कहना चाहूंगा कि our best teacher is our patient. Okay, patients ने हमें बहुत कुछ सिखाया है. Okay, so this is my answer, that hard work, passion, and consistency. Yes.
Right, sir. True, sir.
Yes, Prem sir. Now, I would like to ask you.
All young people.
Yes, and one more thing I would like to add, that me or Prem sir will never give you a shortcut on this. Okay, so don't just ask for any kind of shortcut. See, you are seeing so much hard work from Prem sir as well as from me. Okay, we both are creators and we know how we have earned these 1,000 subscribers on YouTube or on this Instagram. We have earned these subscribers. So we are very क्या बोलते हैं उसको, we are very thankful to our viewers, our subscribers. Yes. So never ever just ask for a shortcut. Yes.
Yes. It definitely, like, it takes lots of perseverance, as sir said. It is not a one-day job for anybody in this world. Whoever is working harder and consistently, they only get success. So definitely that is a real success mantra and the effective success mantra if you want to follow. Otherwise, shortcuts, many people are trying, some of them get it, some of them don't get it, but then that enjoyment is not there. Journey part you will miss. So as sir said, just enjoy the journey. Like, doesn't matter where you will reach, but at least you are enjoying. That is enough.
Yes. Sir, now I would like to ask you something regarding, just give a brief introduction of role of physiotherapy in cardiac cases as well as in respiratory cases as well as in neurological cases. Yes.
Okay. So sir, basically cardiorespiratory conditions like asthma, COPD, emphysema, and other conditions right now, like we can say COVID. So all these conditions, the main problem what patients are feeling is breathlessness, or they have difficulty in maintaining the positive expiratory pressure. So in
pressure.
those conditions, physiotherapists can teach them such breathing exercises which focuses on that particular segments. Like for example, few patients, as just now you said that most of the patient differs. So few patient may have secretions more on the apical lobe of the upper lobe. Few patients may have more secretions in the lower lobes of the right side. So depending on where exactly the secretions are, we have different positions of a patient in which we can make the patient lie down, and after that we can apply the techniques of chest physiotherapy to remove those secretions, so that effectively we can increase their PaO2 level, and definitely it will benefit the patient for the longer period of time, so that we can strengthen their lung muscles and also we can increase their cardiac capacity. Same thing like if we talk about coronary artery bypass graphy, CABG conditions. So bypass graphy
Yes.
is already done for the patient. Then after that, we have seen that lots of patients have difficulty in conducting their daily living activities also, like standing up, going to bathroom, toilet, coming back. All those walking activity also makes them feel tired. So in those kind of activity, physiotherapist can make them accustomed to it, as well as they can motivate patients to perform more activities like daily. By giving them certain sets of exercises, we can make patient run also after a few months of physiotherapy, even if patient has undergone CABG. So that is the role of physio in cardio and respiratory conditions. If we talk about neuro conditions, it has got two branches, like pediatric branch as well as adult. Pediatric branch, we treat all the congenital disorders like cerebral palsy. Then, if somebody is having genetic disorders also, so all those conditions, with the help of physiotherapy, we cannot reverse it, but symptomatic. Like if they are having spasm, or they are having contractures, or some muscle patterns are there. So those patterns can be corrected with the help of neurological rehabilitation treatments, and as well as in neurological conditions like stroke patients, we can give them like paralysis, as we were talking about diaplegic paralysis, or all these conditions, strengthening their muscles, improving their joint proprioceptions, and everything we work on this with the help of sets of exercises. And it is not like only exercises, we have modalities as well. But I personally feel that physiotherapy, World Physiotherapy itself says that physical therapy. So I believe that more we can give physical hands-on therapy, that will be much better for patient in compared to modalities. But yes, modalities sometimes help us to increase the speed of the recovery. So likewise, we have so many modalities as well, which reduces the pain for patient as well as improves muscle function.
Modalities. Please explain these modalities.
Sir, modalities like we have electrical stimulations, we have SWD machines, moist heat. So all these modalities basically are working on the principles of heat or cold, and some modalities
Hmm.
works on the principles of electrical stimulations. So basically,
Hmm.
just
Hmm.
like wiring done in our house for switching on the light. Like let's say switchboard is your brain. You are switching on one light and automatically fan starts. One switch you on, then automatically light starts. So it is like a cables running
Hmm.
through your body same way from the brain. And sometimes if a
Hmm.
cable is damaged, then we can rehabilitate it with the help of stimulations by external stimulations, so that we can generate the more
Hmm.
neurological stimulation, create more movements in that particular pattern. So likewise, modalities also we
Okay.
use for such patients.
Okay. Okay. Very nice answer. So,
Yes.
so many young homeopaths or doctors, if they are watching, they will get this answer. That see what happens many a times after hearing these different so-called chronic diseases. Okay, like COPD or coronary artery disease. People, especially freshie, they just got feared of them कि यार क्या करेंगे कैसे करेंगे okay and whenever even in MBBS okay an allopath who is pressing and he just arrived to hospital, he is doing his job and he don't know anything about यार क्या करना है So if they are listening to this interview, please just follow this instruction of Dr. Prem sir, that in this much of diseases, so many diseases, physiotherapy is really, really very helpful. See, I just want to just share my experience that once upon a time what happened, a cardiothoracic surgeon is going to doing his surgery, the CABG, and he asked me for reference of physiotherapy. See, at that time I was pressy, so I just यार देख लिया न्यूरो में है, ये ऑर्थो में है, कार्डियो में कैसे कराएंगा? Then that Rupesh bhai, Dr. Rupesh Kemp, I think if you are knowing him, he is in Shelby. He came and he explained me so many things regarding this cardio physiotherapy, and I was like, oh, okay, that 3 ball spirometry, yes, okay, for lungs, okay. See, this spirometry is helpful in ortho patient as well as paralysis patient. In ortho patient, how? This is my knowledge, I am sharing, you correct me. That after a surgery, what happens? There are chances of embolism. After a surgery, blood tendency is getting clotted, and if this clotting is big enough to occlude an artery, it can cause paralysis or infarction. So at that time, अगर surgery हुई है, okay, knee replacement हुआ है, just think that. So at first day you cannot walk. So what they were suggesting? They were suggesting this 3 ball spirometry and one that movement, flexion and extension of feet. Okay, okay, yes. So these 2 exercises save the patient from that embolism. So see, this is the miraculous part. Okay, so this is miraculous physiotherapy. I would like to say that. Yes, this is my experience. Yes.
Yes, sir. Any post-operative or pre-operative, sir? Actually, you won't believe. Today only I was thinking that still people know that what physiotherapy can do post-operatively. But people don't know that we can work pre-operatively also.
Yes.
So
Yes.
if
True.
patients are taking pre-operative physiotherapy, post-operatively their rehabilitation, their comeback will be very strong and they will feel like normal person only, even if it is CABG or it is TKR or any surgery. So that
Any
awareness
surgery.
is
Yes. True.
so, but
Yes.
still working on it.
Yes. And I hope in next 10 years, people get to know more and more about physiotherapy from physio trends only.
Sir, anywhere they know,
Yeah.
I won't believe this is like World Physiotherapy Week going on. That is also one of the
Yes.
special reasons that I am interacting with you. And I have started that competition of reel making by all the students or any physiotherapist to spread awareness.
Yes. 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 Yes.
Consider
True.
that I am alone, not able to go into like reach to everybody in this world. But if everybody
Yes.
joins me to spread the right awareness about physiotherapy, definitely we can create a huge impact. So that's the
Huge
idea
impact
behind
and
this.
a better world, disease free world. ओके सो जो भी क्या बोलते हैं कि मूवमेंट से रिलेटेड जो भी इश्यूज है सो वी कैन डेफिनेटली सॉल्व इट डेफिनेटली डेफिनेटली
Right, sir.
यस सर हाँ पानी पी लो थोड़ा आई वुड लाइक टू टेक वन सिप ऑफ वाटर देन यू जस्ट आस्क मी एनी क्वेश्चन
Sir,
यस सर
I just would like to answer one question from the comments. First, how many years course physiotherapy is? So I just want to tell that person that it is 4.5 years of course, 4 years of study, and 6 months of internship. So I guess they can come to know about the physiotherapy course. Okay, sir. Then also one more thing, I was just curious about homeopathy, sir. That now we know that what is homeopathy, what is physiotherapy. Now, sir, how?
सर योर camera is I think your camera is turned off
Okay, okay, sir. Sorry. Am I able now,
हाँ
sir?
Now you are visible.
Okay. So, sir, I was just saying that
Yes, yes, sir. Continue.
yes, like, sir, we know now that what is physiotherapy, what is homeopathy. So, future that how these two therapies can work together, and for me, I think it will create wonders if both of these are working together. But what is your opinion about it?
See, definitely, as I have told you that previously I didn't know anything regarding physiotherapy, and with so much hard work in both the fields, allopathy as well as homeopathy, I got to know so many things.
Mm-hmm.
See, I would like to mention some diseases here, like in bronchiectasis patient. Okay, if you know the bronchiectasis, what happens? The airway or passages, they are getting so much troubled that the normal anatomical pattern is disturbed,
Yes.
and there are mucus plugs over there. So whenever the patient is changing his position, what happens? That mucus or expectorant जो बाहर आता है, it moves from that place and goes to the airway, and what it creates? It creates the cough reflex. Okay, and this is very embarrassing to each and every patient suffering from bronchiectasis. And in India, see, we know that almost 60 to 70% of people lives in villages. Okay, and they don't have the privilege of this gas or pipelines.
Mm-hmm.
Okay, LPG gases or CNG, PNG connections. So they are using chula.
Yes.
Okay, so the females from villages as well as males क्या करते हैं? They are smoking. Okay, smoking bidi. See, bidi is more dangerous than these cigarettes.
Mm-hmm.
Okay, they are smoking chillums.
Right.
So this causes COPD, chronic obstructive pulmonary disease. And we all know that everyone is treating themselves on their own. Okay, कहीं पे भी पढ़ लेंगे, किसी ने कहा तो वो ले लेंगे, गूगल कर देंगे, यूट्यूब पे देख लेंगे, डॉक्टर के पास नहीं आएंगे.
Right.
Okay, and ultimately that COPD is converted into this bronchiectasis. Okay, so in cases of acute bronchitis, COPD, then bronchiectasis, see, as a homeopath, we can treat all these diseases.
Mm-hmm.
Okay, but we need physiotherapist in this. Okay, how? So क्या होता है कि in COPD also there is damage to structures of alveoli as well as airway. So patient could not cough, could not raise his sputum.
Right.
In these cases, a physiotherapist can do that huffing and puffing and bring that sputum to the surface. Proper cough reflex. Help us to clean the lungs so that our medicines can work better. Okay, and patient feels better. So this is a single example. The another example, as I told you, in cases of paralysis. Okay, our homeopathy has tremendous medicines for cases of paralysis. So in that also physiotherapy is mandatory. Okay, we all know that whenever there is peripheral nervous system involvement, peripheral nervous system paralysis, what happens? These paralytic nerves are going into degeneration, and almost in 1 or 2 years they get better. But they get better with the help of physiotherapy even more early. Within 3 or 6 months, I have seen so many patients recovering from paralysis within 3 or 6 months.
Yes.
So here also homeopathy needs physiotherapy, or the general medicine needs physiotherapy. And in cardiac cases, as you told us, that even before the surgery, post surgical तो है ही उसका role, but pre surgery you can use this physiotherapy. So if we are taking this combined approach, it will be very fruitful to our patients. Okay, and it is for the well-being of patient as well as well-being of society too.
Yes.
So this is my approach, my take on homeopathy and physiotherapy.
Yes, and sir, really proud to see that at many places this combined approaches are also taking place. Like we know that in our Ahmedabad campus itself, we were doing that combined approach for homeopathy and physiotherapy. Likewise, there are so many other places where they are encouraging that this both therapies go in combination, so patient gets maximum benefits of it, and it can be useful in any condition. Because right now,
See, right now,
yes, that
yes.
people are more afraid of getting side effects rather than actually getting effect from the medicines. And homeopathy and physiotherapy is something which is not never going to give you any side effects. So now I
Side effect,
think
yes.
that kind of encouragement also patients are getting and patients are accepting that treatment. I am really happy to see that.
See, right now I am working with Nova Health and Wellness Clinic, and in this clinic we have physiotherapy as well as homeopathy.
Right.
Okay, we are providing both these things to our patients. So it is like a polyclinic. See, since so many years, this polyclinic concept is flourishing. So in Nova clinic, we are providing this. In future, I would like to talk to that our leading physiotherapist of this Nova clinic, and अगर हो सकेगा तो मैं उनसे बात करूंगा और हम आगे इसके रिलेटेड बात करेंगे. यस.
For sure, sir. For sure. We can have.
ओके सर. सो मैं एक क्वेश्चन पूछता हूँ नाउ. फिजियोथेरेपी, होम्योपैथी, वी ऑल नो.
Mhm.
आई वुड लाइक टू आस्क यू रिगार्डिंग फिजियो ट्रेंड्स. ओके. सो जब आपने ये स्टार्ट किया था, आई नो आपका स्टार्टिंग शायद मुझे थोड़ा मालूम है, तो क्या ख्याल था आपके मन में, अभी कैसा जा रहा है, और क्या आपका फ्यूचर प्लान है? व्हाट इज योर फ्यूचर प्लान फॉर दिस फिजियो ट्रेंड्स?
Sir, thank you so much for asking this question. Nobody asks me this, but I'm really like feeling proud to say this that physio trends, sir, I started just for fun. I'm telling you, I just started
ओके.
for fun. I see memes on it, sir, about physiotherapy
ओके.
and kinds of patients I used to see every day. Like, you know, there are different types of patients. So, like, for example, I'll tell you that patient will come and tell me that my doctor has told me that I have to do this is exercise, so you teach me this exercise only. And suddenly I think like, buddy, when your doctor studied physiotherapy, you tell me that first. Your doctor has done work, he has given you medicine. Physiotherapy work is mine. So those all burden was there in my mind that everything I used to remove in memes. So that was the born of physio trends, like small thing I started with. After that, just things, and that time also the concept was clear. Base was that only that I want to create awareness about physiotherapy. The medium was memes that time, but then after that I started with workshop. You know about it that I conducted a workshop.
यस.
Harish Krishna sir in Gujarat, and because of that, lot of changes came in my life. Like I understood that I need to something by my own. Then only I'll be like at somewhere. So that is where this physio trends led me. And after that, COVID scenario came, and in that, I became serious about physio trends. I started making people aware, as well as I started posting all the exercises, videos, then what physiotherapy can do in certain conditions, because patients were helpless. They were not able to go to physiotherapy centers or anywhere. So they didn't know that what
यस.
exercise they should do. So those are exercises I should make videos, and I used to send it to them. I started with one application also in between. I had my own Android and iOS based application on everybody's phone, patient's phone, and by which I used to give them like all these exercises and sessions, everything. Then later on, I thought that okay, by application I can reach only to certain number of people. So for making it much bigger, I started a YouTube channel. In that also, beginning I didn't know how to work it out. Like I just used to, keep post all the exercises and then just forget about it. I know that how to
Yes.
do marketing of it and all. So like little bit while the journey was going on, I learned things. Then I started putting more efforts on it. I started creating good content, and also started promoting it a little bit, and I really got a very good response from people and my students. Everybody supported, and then slowly I just grew. And future, if you ask me, the main soul of physiotrends is same, that I want to spread maximum awareness about physiotherapy. That is the soul of physiotrends, so that is going to be there forever. And future projects I
Mhm.
my mind are like, I want to do something separate for student population and separate for patient population, because I have seen that students are also suffering a lot, sir, in this COVID situation.
True,
They are not getting practical exposure. They are not getting
true, true.
things. So for them, I want to create such content that they can have at least a glance of that practical exposure. At the same time, for patients also, that they can be independent. Basically, sir, it is all about Atmanirbhar Bharat.
True, 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 sir.
I
Ji.
want
True.
everybody
Great, great.
independent. That yes, you
Yes,
take your charge,
yes,
you do your exercises, and you will never need anybody else. And if you need any
yes, true.
guidance, that that's it.
Yes, 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 true. Great, sir. Great.
So
See,
that's
great.
what I
See, I am. Yes, yes, true, true, sir. मैं रोज आपकी पोस्ट और ये सब देखता रहता हूँ एंड मेनी अ टाइम्स व्हाट हैपेंस टुडेज मॉर्निंग और जब भी I just assume the time or I just see the timing at which you have posted that. मैं सोचता हूँ साला इतने बजे मैं उठा था कि नहीं उठा था because you were there at 5 a.m. 6 a.m. many a times with cycle and all these. See, people don't understand कि आपने कैसे किया. People हाँ ये इसने पोस्ट कर दिया होगा हाँ. They don't understand that hard work, okay, और that क्या बोलते हैं struggle कि यार कैसे वहां तक पहुंचे. मीन्स शूट कैसा करना है, लाइट आ रही है कि नहीं आ रही है, कैमरा में कैसे पकड़ूंगा, कैसे लगाऊंगा. ओके, एक पोज दिया या एक एक्सरसाइज की या एक जंप किया, एनीथिंग यू डिड, बट कैप्चर हुआ है कि नहीं.
yes.
ओके, कैप्चर हुआ है कि नहीं. दिस स्ट्रगल पीपल डोंट अंडरस्टैंड.
Yes, sir. So many
Okay.
times it happens that like you are keeping a camera, you start doing exercise, but recording is not doing. Many times
No, yes. So many times this happens with me also.
right.
ओके कि माइक चालू नहीं हुआ है, माइक का बल्ब नहीं लगा है, वो पिन नहीं लगाया था तुमने, क्योंकि बोलना है, तुम्हें तो बोलना ही है.
Yes, yes.
सो दिस स्ट्रगल पीपल डोंट नो. उन्हें लगता है कि यार ये क्या, ये आके बोल देता है, ये कर लेता है, ये तो मैं भी कर सकता हूँ. आई कैन डू 20 पुशअप्स, आई कैन डू 100 पुशअप्स एट अ टाइम. या एक महीने मैं करूंगा तो मुझे भी, अरे लेकिन भाई ये 100 पुशअप करने की बात नहीं है. ये एक चैनल क्रिएट करके अवेयरनेस क्रिएट करना है, फॉलोअर सब्सक्राइबर्स इतना बढ़ाने की बात है. एंड दिस इज नॉट इजी टास्क. ओके, सो इट इज commendable effort. You are doing a tremendous effort to make physiotherapy known to each and every individual, especially your patient, and your effort to make it understand to your students too.
Yes.
This makes this physio trends unique.
Because sir,
Okay, and
students are future of any therapy we take, either it is homeopathy,
yes,
physiotherapy, anything. And if our students are capable enough to spread right awareness, then we don't have to worry about anything. So I really
true, true,
appreciate
sir.
that.
Yes, true, sir.
Yes.
So, being a creator, I know that how many problems we are facing.
Yes.
See, कई बार क्या होता है कि we got demotivated कि यार लोग देख नहीं रहे. इतना अच्छा लेक्चर दिया था. That happens. So this is really hard.
Like normal class also, sir. When you are taking class normally, like 50
Hmm.
students are there, you will notice, like, because when we are taking class, we notice everything. We notice that 5, 6 students are there who are about to sleep. 2, 3 students are there who are into their mobile or they want to talk with some other friends. But ultimately, what I think is what matters is if only one student also learns from my class, no, that is enough.
Yes, yes, yes. And this is motivation for us.
Yes.
कि यार 50 व्यूज है, मेरा अभी क्या रहता है कि 100 व्यूज है, ओके, मुझे 100 तक जाना है, बिकॉज माई फेवरेट स्पॉट इज क्रिकेट एंड वी ऑल नो अबाउट के क्रिकेट में क्या इंपॉर्टेंट है, 100, ओके, तो 100 व्यू कर लो, ओके, देन योर वीडियो इज जस्ट ओके, फिर जाएगा, चलो 100 लोगों ने देखा है, क्या है, 3 नंबर्स में पहुंच गया है, देन आई जस्ट बी रिलैक्स. अगर 100 तक नहीं गया है, देन आई वुड बी वरीड कि यार कुछ गड़बड़ की है मैंने इसमें. आई हैव क्रिएटेड.
I don't think it is like that, sir, because sir, in this lots of factors plays a role. Even I used to initially think that we are doing some, definitely yes, we have to improve ourselves, but at some times, sir, there are lots bigger things which are not under our control. Like you must be knowing that SEO is there, your hashtags and all. Like everybody cannot put the right hashtag every time, sir. So
Yes.
also, even if it takes time, it's okay. You just trust your content and the continuous awareness about it. Definitely, we will achieve it. That's what I think.
Yes, yes. And wait for that 1,000 subscriber and 4,000 view hours.
And sir, tomorrow, just now you told me about the belly fat. So tomorrow, my one video is coming. Tomorrow morning, I'm posting it about reducing.
See,
What is the
yes,
and the scientific method to understand that. So I have tried to describe it. Let's see how many of people gets benefited from it.
see, yes, yes, sir. See, there is a comment from Ravi. It is amazing, sir. Keep us the never die spirit. Yes. See, अगर प्रेम सर है, जैसे उन्होंने अभी कहा कि कल ही उनका वीडियो आ रहा है, मेरा तो अभी कोई ऐसा कोई रिकॉर्डेड वीडियो एक है, लेकिन अभी नहीं रखूंगा मैं, क्योंकि दैट वीडियो इंक्लूड्स वन मोर पर्सन. बट क्या है कि क्रिएटिंग अ कंटेंट, ओके, एंड टीचिंग समवन ऑनलाइन ऑन दिस यूट्यूब वेयर देयर इज लोड्स ऑफ कंटेंट, एंड उसके बीच में लोग आपको क्यों देखेंगे? ठीक है, अगर नजीब सर पढ़ा रहे हैं फिजियोलॉजी, तो डॉक्टर कृणाल डाभी को कोई क्यों देखेगा? सो देयर मस्ट बी सम यूनिकनेस. ओके, when I started my channel, what was my thinking is कि जो भी क्वेश्चन मैंने फेस किए थे ड्यूरिंग माय BHMS, माय बैचलर डिग्री कोर्स, तो वो क्वेश्चन मेरे स्टूडेंट को फेस नहीं करने पड़े. दिस वाज माय सोल मोटो फॉर स्टार्टिंग दिस चैनल. मैंने भी ऐसा नहीं सोचा था कि 1,000 सब्सक्राइबर हो गए, 4,000. मैं तो जानता भी नहीं था कि इतना सारा करना पड़ता है. ओके, आई डिडंट न्यू कि भाई मेडिक टॉक्स में स्टार्ट करूंगा तो मुझे इतना बेनिफिट कब होगा, कैसे. नो, आई जस्ट वांट टू शेयर माय नॉलेज, एंड सो मेनी पीपल, माय फादर, माय ब्रदर, दे हैव टोल्ड मी कि नॉलेज जहां से भी मिलता है ले लो और नॉलेज को देते रहो. ओके, बट द स्ट्रगल इज वेरी रियल. Struggle is very dangerous. You don't know. Many times what happens, you just know each and everything from a chapter. Suppose ECG. Okay, you know each and everything. But during shooting, you just forget to mention something which is very essential to the ECG.
True. That happens.
Now you, in this shooting, you have to follow the script.
Yes.
Okay, you must follow the script like a textbook.
Yes.
Okay, so this struggle, if people understand, I believe that our 1,000 subscriber अभी तो हो गए हैं, चलो, लेकिन अब 10,000 या 1 million पर हम अगर पहुंचते हैं, 10,000 1 lakh पर, तो अगर people understand this, we got our subscribers too early, we got our channel monetized too early. Yes, but this factor is keeping moving us कि भाई नहीं, अभी करो, अभी कुछ और करो, अभी कुछ नया लाओ. ठीक है,
This is nothing.
yes,
There is lots of more struggle waiting for us. That's what I believe. This is
yes, true.
Lots of struggle.
True. Lots of struggle.
Yes.
And yes, Prem sir is daily he is thinking new ideas, and I would like to ask him कि आपको ये सारे आइडिया कहाँ से आते हैं कि मैं भी अप्लाई करूँ अपनी चैनल पे और मेरे भी सब्सक्राइबर्स ऐसे बढ़े. सी वन मोर थिंग कि जब हमने ये प्लान किया था तो उसके बाद क्या हुआ था कि थोड़ा मैं बिजी हो गया था, मीन्स सो कॉल्ड बिजी, नॉट दैट मच बिजी. ओके, देन प्रेम सर रिमाइंडेड मी कि सर ये करना है अपने को. मैंने बोला हाँ सर करना है. सो एट दैट टाइम ऑल्सो आई वॉज वॉचिंग समथिंग न्यू. ये फिर ये मैंने रील वाला देखा. मैंने बोला सर आप ये कैसे आइडिया लाते हो. तो जो भी स्टूडेंट ये देख रहे हैं, फॉलोअर्स देख रहे हैं, आपको अपनी लाइफ में अगर कुछ आइडिया चाहिए तो यू कैन आस्क प्रेम सर. ओके, बहुत अच्छे अच्छे आइडिया आपको डेफिनेटली वो प्रोवाइड करें.
Give you idea if I get it. I don't mind giving you idea because भाई एक और चीज है सर इसमें कि आइडिया आना एक अलग चीज है और वो आइडिया को हकीकत में बदल वो एक
हाँ, यस, ट्रू ट्रू, एंड यू आर डूइंग दैट.
हाँ क्योंकि सर ऐसे तो मैं आपको बताऊं ना, मुझे ऐसे बैठे बैठे और 4-5 आइडिया आ जाते हैं, पर जब मैं सोचता हूँ ना कि इसको हकीकत में कैसे कन्वर्ट करूंगा दिस थिंग.
सी हमने अर्लियर सक्सेस की बात की, तो जो भी बंदा, सभी को दिमाग में 1000 आइडिया आते ही है, ठीक है, लेकिन जो बंदा ये आइडिया को रियलिटी में कन्वर्ट कर सकता है वही लाइफ में सक्सेस हो सकता है. सो दिस इज द मंत्र, ठीक है, कि जो हम थोड़ा मॉडिफाइड करें, हार्डवर्क, देन परसिवरेंस, देन दिस कंसिस्टेंसी एंड making their knowledge or making whatever they have thought a reality.
Yes.
Okay, that is the mark of success.
True. So that's what, like, आइडिया तो आ जाता है बट उसको रियलिटी में चेंज करने में थोड़ा टाइम लग जाता है कभी-कभी.
Yes, true. And अभी क्या 8 September, I think, if I am not wrong, 8 September is World Physiotherapy Day.
Yes, yes, sir.
Yes, sir. Please tell us about World Physiotherapy Day and what you are planning. आपने जो भी रील का कंपटीशन जो रखा है वो फिर से एक बार बताइए हमारे व्यूअर्स को.
Sir, basically, what I planned was that, as I told you, I want to spread maximum awareness about physiotherapy. So that is why I planned this reel making competition. And recently, I got collaboration with Fast Stand Up India. So I wanted that.
Wow.
So I just wanted that I give my viewers or winner of that competition some advantage of it. So for that I struggled with it. I talked out with them that you give some prize to my winner, then only I'll do something more about this collaboration and all. So they agreed to it. So I have got 1,000 rupees voucher from Fast Enough India for the winner, as well as from my side, from Physiotrend side, I am going to give some gifts to the winner. So that is the motivational factor for the people to create some content reels about the physiotherapy awareness. So that was the basic idea.
Great.
But till today, I have got response of it, but only like I can say 4 or 5 people are there who are making the content and doing, and I'm happy. As I told you, even if one student is doing the work, I am happy with it. So 4 or 5 reels have come up, but I am expecting that in this next 3 days, more people will come up with their content, because some of people wait for the last day that I will put my content on the last day, you know, like it will get more popular, something like that. So that is what is going on about the competition. And what I am going to do is, I am also going to do the same thing. I am also going to put one reel about physiotherapy awareness. And as always, it is going to be somewhere funny and obviously informative for my viewers. So that's a plan.
कैसी रील बनानी है जरा वो भी आप थोड़ा हमारे व्यूअर्स को समझाएंगे तो.
सर लाइक अगर आप मेरे प्रोफाइल पे जाओगे तो मैंने काफी रील्स बनाए हैं फिजियोथेरापी के रिगार्डिंग की. जैसे कोई पेशेंट है,
यस ट्रू,
उसको जब चोट लगती है तो दे ट्राई ऑल दी ऑल्टरनेटिव मेडिसिन्स, बट देन व्हेन दे ट्राई फिजियोथेरापी दे रियली गेट बेनिफिट्स ऑफ इट. सो दैट इज वन वे ऑफ passing the knowledge that physiotherapy is really helpful for certain conditions. Same way, as I told you, that most of the people think that physiotherapy means only exercise or only massage. So no, it is not only massage, not only exercise, but it is much more than that. So that kind of message, if you want to pass on, you can pass on with the help of reel. You can sing a song, you can dance, you can do some skit, whatever you want to do it. But you just spread this message that how physiotherapy can be helpful in your daily activities and daily things.
Okay. So I would definitely like to try this idea. Let's hope I can make a reel really, and I would like to just tell you that I would like to win the first prize if my reel is really very good.
All the
Yes.
best for that.
So all the best for your this reel making competition. यस हमारे व्यूअर्स को मैं बताना चाहूंगा कि प्लीज पार्टिसिपेट इन दिस काइंड ऑफ इवेंट्स बिकॉज आफ्टर सो मेनी इयर्स इफ यू विल लुक बैक, अगर आपको दिखाई देगा कि यार ऐसा कुछ हुआ था कि जिसके बेस पे आज इतना सारा खड़ा है, ठीक है, तो आपको तब ऐसा नहीं होना चाहिए कि यार मैंने क्यों पार्टिसिपेट नहीं किया. ओके, सो प्लीज 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 आप सभी जाइए, सर के पेज को चेक करिए और उस रील मेकिंग कंपटीशन का हिस्सा बनिए.
Thank you so much, sir, for encouraging people for joining.
Yes, sir.
And,
yes, one more thing, sir. अभी एक दो क्वेश्चन बाकी है सर, कि थोड़ा मोटिवेशन थोड़ा हो जाए मेरे लिए और हम सब हमारे व्यूअर्स के लिए, कि बॉलीवुड में तो हम जानते हैं कि अक्षय कुमार भाई 4 बजे उठ जाते हैं, 5 बजे उठ जाते हैं. मैं 6:30 बजे उठता हूँ.
Okay.
और अपना डेली रूटीन खत्म करके कॉलेज जाता हूँ. तो थोड़ा फिजिक अच्छा हो ऐसी दिल की तमन्ना है, ठीक है. सी मेरी मम्मी मुझे हमेशा कहते रहते हैं कि जितना तू सोएगा उतनी तुझे ज्यादा नींद आएगी. एंड आई हैव फेल्ट दैट जितना तू खाएगा उतना तू भूखा रहेगा, ठीक है. तो पहले मैं कैसा ऐसा लीन थीन हुआ करता था, फिर बॉडी अच्छा बना शेप में, फिर जो शेप है वो थोड़ा आपको मालूम है ना, 6 पैक में से फैमिली पैक आने स्टार्ट हो गए, लाइक दैट. सो प्लीज प्रोवाइड सम दैट काइंड ऑफ मोटिवेशन कि जिसको हम माइंड में रख के चल सके और हम एक्सरसाइज कर सके.
सर ऐसा कुछ खास बड़ा मैंने कुछ सोचा नहीं है, बट द ओनली थिंग विच आई फॉलो इज दैट आई रेड समवेयर सर in book that if you really want to do something and you are thinking about it, count till 1 to 5. Till 5 count. If you are not getting up and doing it, that means you really don't want it. And if you really want it, within the 5 counts you will get up and start doing it. So I follow the same thing in my mind, that if I wish to do something, I count till 5. That 1, 2, 3, 4, 5. Before 5, I should get up and start working on it. If I'm doing it, that means yes, I really wish to do it, and that works for me. That's it, sir.
वाह 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 सर, आपने तो बहुत बहुत बड़ी बात कर दी. दैट मीन्स सर आप जितना वर्क करते हैं उसके हिसाब से तो आप दिन में बहुत सारी बार 5 तक काउंट करते ही होंगे. यस,
कभी कभी अंदर मोटिवेशन की जरूरत है होती है तो आई हैव टू डू इट, अदरवाइज it goes with the flow. Like once you are on your feet, then you keep on doing it. Then you don't even have to think about counting for 5. You just keep on doing it. That's what I feel. So एक हैबिट बनाना है, बस एक अपने आप को एक थोड़ा सा स्पार्क लगाओ कि भैया 1 से 5 में नहीं खड़े हुए, मतलब तुमको वो चाहिए ही नहीं, तो बेटर है कि खड़े होके काम शुरू कर दो.
वाओ सर, ग्रेट सर, ग्रेट. ये मुझे भी बहुत हेल्पफुल रहेगा, हमारे सब्सक्राइबर फॉलोअर्स को तो हेल्पफुल रहेगा ही रहेगा, बट मुझे भी आई थिंक मुझे भी बहुत ही हेल्पफुल रहेगा. थैंक यू फॉर दिस ग्रेट टिप सर.
ऑलवेज वेलकम सर.
यस सर, यस सर, यस सर. इफ यू हैव एनी क्वेश्चन नाउ.
Sir, bus, I don't have any other questions for now, but definitely I loved talking to you and this session. And I want
Sir, it is showing 20 seconds remaining, huh? So just complete, we have to complete this.
yes, sir. I just want that
Okay.
we make another session again with another topic.
Yes, true.
And thank you so much for this, sir.
Thank you, thank you, thank you.